You like to?
I don't know what was going on. So thank you, Madam Chair. Davante Lewis with the Louisiana Budget Project. This is I'm kind of short. I'm not going to add too much more. I'm just going to provide just some context about what the stakes actually look like in Louisiana when it refers to sick days. So, Representative Meek, as we were talking about the CARES Act, and I just wanted to make sure we mentioned that provision only includes employers who have less than 500 employees. So some of your grocery store workers at an Albertsons or a Kroger's at our Walmart are not covered. So they are on the front line who may also miss some of the paid sick leave. So there's approximately somewhere around 784,000 Louisianian workers who may not get paid sick leave under the COVID CARES Act requirements. And I would also note that the provision of this bill goes into effect on January 1st, 2021. So even though we are talking about it in the context of COVID, it is also just kind of in the context of a health epidemic. And I would add, when we think about that, we have to also think about public confidence. We're talking a lot about public safety, but I think an important note is public confidence. And when we're talking about especially cities like New Orleans or our tourism, we're going to now be in a situation where travelers and tourists are going to think about their health and their safety. And they're going to want to go to places and hotels and restaurants and events where they know the individuals there, if they are sick, can stay home. And too often times we are putting people in a process of determining whether or not they could put food on their table or if they can take time off and sick. And so that, in effect, could create a public confidence issue where people are not necessarily going to trust going somewhere where they know employees may be there sick. And so when we talk about paid sick days in Louisiana, I just want to kind of be clear that only 18% of workers who work in the food service industry in this state have an access to a paid sick day. Only 26% of workers in this state have access if they are in the industry of personal care. And then about 55% of the total private sector of the state of Louisiana has access to paid sick days. And so when we think about economic value, the National Library of Medicine has stated that the United States has lost over $234 billion in productivity because of lack of access to sick days. So this is also an economic issue that we talk about. That could really pay the difference. And Representative Willard and Susan has already mentioned the 12 other states that have enacted this. And so we just want to talk about the 700,000 plus Louisiana workers who have no access to sick days and working towards a policy that would allow them. And when we think about a state that is low in income and has many people impoverished, we're talking about less than the lowest 10% of income earners in this state. Only 30% of them have access to paid sick days. The lowest 25% of earners in this state, only 47% of them have paid sick days. But the highest 25 earners in this state, 92% of them have access to paid sick days. So we're not also talking about, we're talking about a very big income inequality when it comes to access to paid sick days. And we can also get into the racial disparities where we know most of our frontline workers, most of our essential workers, most of the people who have no access are the black and brown individuals in this state. And we should also talk about equity in the terms. So that was just some of the context and information that I wanted to provide to the committee. Thank you, Madam Chair.
All right, thank you.